Hey, hey,
Hi, Greg. I forgot to update my name. This is Shadananda. How are you?
hey, how are you?
Good. Can you hear me okay?
Yes.
Okay, thank you. I actually have two questions tonight, both follow-ups.
Okay.
Um, One is for my niece.
Okay.
You were helping her with a protocol for, um, uh, I guess, kind of like a PTSD trauma response to, being on lockdown for the 2 years with COVID, losing her junior year, her senior year, and then her dad died. September when she was going to college.
Yeah.
Um, and so for her anxiety at night, she's doing vetiver and helichrysum and loving it.
Okay, good.
It's totally continuing. She's been on that for months
Okay.
to reduce the anxiety for like 23 hours a day. It's perfect.
Yeah. Yeah.
And then she needed some help to focus because she's in college
Mhm.
um, and so you were saying that her inability to focus is probably more of a trauma response.
Yeah. Yeah.
So she was taking a go. I always get these vowels mixed up. Go to cola or go
Okay.
to
Yeah.
kolu.
Yeah. Uh-huh.
um, and so she did that actually for a week, and then no. I'm sorry. She was supposed to do it for a week, but she did it till the bottle emptied. So she did that for like 3 weeks.
Okay.
Um, um, Twice a day, 3 capsules.
Okay.
And then inhaling cinnamon leaf in the morning, drinking 2 drops. Uh, she was supposed to do that for 3 days. She did that, and she's continued with the cinnamon leaf and then basil throughout the day. So her her ability to attend to task is better, but she's still fighting with her mind to be able to focus for she said the protocol is working for like 20 minutes, but she can feel herself. She can feel the shift in her brain. She's able to focus. She's not battling against herself to pay attention, but within 20 minutes of taking this protocol, she's back to
You just
being
slides back.
spacey. Yeah.
Okay. I mean, it shows that it's working, but something else is going on. Yeah.
hmm And I know that, I mean, the loss of her dad is, that's probably going to be with her the rest of her life. So there might not be a oil for that, but she just can't focus more than 20 minutes.
Give me a minute just to process this for a minute.
Absolutely.
I think it's one of those things where we'll have to treat and see how she responds. I kind of like all those things in play. You know, if the Gold Cola helped her enough to where she wants to continue, I think that could be fine. I mean, obviously, I mean it's a tonic herb, so it could be fine. But you know, doing the process shows that something's working, but then something else kind of comes in. And when I go through and look at her, like I don't know the proper way to say this. Like it's almost like there's a projection of what it means for her father to be gone.
Yeah.
Um like on school, on life, you know what I mean? Maybe not on life, but like just on maybe certain aspects in our world. And um we want to be able to go through and diminish that. And I think that's like pretty normal, especially her age. Like you know, she's in the process of going from you know being raised and being somebody's child to like becoming an adult and trying to like you know do things to make it in the world. And even though she might be on her own at college, there's still like this prepping for the world. You know what I mean? Like going out and surviving and things. And I think there's just a little bit of a projection on there. And um it's not even that it gets overwhelming for her. I think it probably more than anything gets like confusing. Like you know, it's um kind of going back and forth between what's happening and like the potentials in the mind. You know, and like we all
Like a
kind of
default,
what's that?
like a default, like a default
Yeah,
setting.
like yeah, like you know, we kind of like we all kind of do this, like to a certain extent. Like when you're unsure of something, you start kind of going, well, this is the worst case scenario, or this is what that means, or like, you know, I'm never going to have any support out in the world again. You know, it's just like, you know, and some of it's probably unconscious and some of it's probably very conscious. And so I don't know that it even really matters what the content is of it. It's just that she's like in that kind of place.
Mhm.
And you know, you could even say it's part of the grieving process. And the grieving process can be very different for people at different stages of their life, you know, and being where she's at now versus that if this would have happened 10 years from now, you know, she would still be upset, I'm sure, and all of that, but she would process it a little bit differently because, you know, she's been doing other things in the world. And so um there's a couple different routes that we could go. That's why I'm like kind of going, like probably the easiest route is and it might be the thing that just resolves it. I would kind of keep everything in place just because that's also all those things are good for a college student going and grinding with a crazy schedule. Like you know what I mean? That's good for a lot of different reasons. But you know, the helichrysum definitely helps with the trauma. But I think there's just some lower emotional responses that are even like kind of like survival oriented. So that would make it like physiological that you know turns into a thought process or like emotional responses and things that just needs to be um, diminished somewhat. And I think probably the best bet is to let's stick up like a little bottle of that blend Gilead
Mhm.
in her pocket and just throughout the day just smell it. And we'll smell it whenever she's starting to like space out, smell it whenever, you know, because there's just like when somebody passes, like one of the things I look for is like say abandonment and everything. And it, you know, there might be a little bit of that there, but I think it's just like I don't know how close they were, but it just looks like there's a little bit more of an emotional response of like making it on the world because dad's not there. Like
Yeah,
if that,
that's her. They were very close,
yeah,
but
just
he
like
was her, more like her
her,
rock, her
yeah,
touchstone.
yeah, her guide, her whatever you want it to be is just
Mhm.
now she's got to do it without him. And there's just, it's not even like there's like, oh, there's this emotion. It's just like a myriad of emotions. Like I think it's just like bouncing all over the place. And every little situation is not like a trigger, but like a little micro trigger. Like, if dad was here, this would be so much easier. Or if dad was here, fill in the blank. I think it's just a bunch of things like that.
Mhm.
And so I like Gilead for that, for her.
And
And
continue with the others, the
I would
basil,
continue with the
cinnamon leaf.
others. The basil is very good for cognitive processing. It's very good for mental stress, which is a college student thing. The cinnamon, very good for keeping your energy levels up, strengthening the brain, stimulating all the body's processes. The vetiver at night, helping her sleep. And, at some point, she can probably let go of the helichrysum just because that's a little bit more trauma oriented. I mean, it still is very relaxing and soothing and things, but, you probably get by with the vetiver. But I was kind of hoping that the helichrysum would knock out some of those emotions, but I think there's just too many like little I'm calling them micro triggers where it's not like something negative. It's just like if dad was here, this, if dad was here, that, if I
Yeah.
gotta go out and do this, and like I don't have dad to call or give me advice or whatever. And it's great that they had that kind of relationship, but it's going to take her a little bit to adjust.
Yeah.
And I'm sure she has the strength and the ability to do it. It's just kind of getting her legs under herself for a
Uh-huh.
little. And so I would just say, let the Gilead just kind of mop it up. A lot of times I would go like Tarragon for something like this, just because it's has to do with shock and a little bit of stress and bouncing out the nervous system. But when I look at her, I don't think that's the issue. I think it's there's the grieving of her dad, but then there's also the acclimating to that loss and like a practical sense. And I think that's part of the thing that kind of is those micro triggers.
Mhm.
And we just gotta clean that stuff up as she kind of goes through it. And it probably shouldn't last very long. I mean, it's different from person to person. Sometimes people are able to kind of work through that in maybe a month or two. But I mean, if they were really tight, it might take a little bit longer. And I've seen some cases which are extreme and an anomaly, but where they've taken years. But it's usually somebody later in life that had that same kind of relationship, but later in life,
Mhm.
and the person usually had some sort of difficulty that the parent was helping them with. You know what I mean? Like it's not just like a normal situation. Like there was usually some particular struggle that they were helping them with. And so I think if the Gilead should just go through and clean that up, because I mean, Gilead is literally for cleaning up lower emotions, and it was made specifically for pain, physical pain. But here it's kind of like mental pain because of the lack of the presence of her dad.
Mhm. Mhm.
So I think that's probably the best bet. I mean, we might have to adjust, but my guess is that's probably going to hit it.
Okay, and all of these are inhalations, right? Except
Yeah, well,
helium, she
that
applies it.
one she could, yeah, that one she could put on her wrist a few times, several drops on her wrist. She could take a salt bath, but definitely inhaling it a whole bunch. Like
Okay.
just I'd say whenever she's starting to feel like out of focus or a little bit triggered, or I say triggered, but I don't even know that that's the right word. Like like confused isn't the right word. Triggered, it's almost like I mean, her. I think you probably know what I'm talking
She just
about.
checks out.
Yeah, and so you know that whole idea of checking out is a response to pain. You
Yeah,
know, and I
okay.
think if you just calm down the pain, I mean, sometimes with the checking out, we use things like spikenard or vetiver or Litsea on the arms and legs, just to minimize it. But I don't even know that that's necessary. I think it's just like a Gilead thing
Okay.
to calm stuff down. It
Okay, thank you.
it's just, I always think that, like, it's kind of great that they had that kind of close relationship, but when a parent passes, like when somebody's real close and they're still kind of at that young age, I mean, it takes them a little while to adjust.
Yeah.
And I think she's very capable. It's just she just needs a little bit of time. And if she wasn't in college, it would probably be a little bit easier. But like college is a big deal. Getting out of college and what you're going to do in the world is a big deal. It's like part of it is like the time of her life. Like if this happened 5 years earlier or 5 years later, she'd be having a different experience. But because it's in this time where I don't want to say she's like in a scary situation, but a lot of change already happening for her with college, and then what happens after college, and so it's just a lot on her plate.
Yeah, yeah, for sure.
Yeah.
Okay. Thank you. And I needed
If
to
for some reason that doesn't work, I mean, we can adjust. We might even be able to adjust just even with stuff that she's already doing. But I think just some inhalation, not even a pattern or anything, just have her inhale, put a few drops on her wrist, those kinds of things. Um, she should probably be okay.
okay.
Yeah.
Okay.